We have 5 more minutes. Okay, we'll start. Hello, good morning, good afternoon, and good evening to the people for whatever time zone you are currently in. As we all know, we are here today to listen to Professor Kron on the topic Medical Physics Workforce Development for Emerging Technologies. To give brief introduction about our presenter, Thomas Kron was born and educated in Germany. After his PhD, he migrated to Australia in 1989, where he commenced his career in radiotherapy physics. From 2011 to 2005, he moved to Canada, where he worked at the London Regional Cancer Centre on commissioning of one of the first helical tomotherapy unit. In 2005, he became principal research physicist at Peter MacCallum Cancer Centre in Melbourne, Australia, where he is now Director of Physical Sciences. He is on the editorial board of several scientific journals, including Radiotherapy. He is regular consultant of International Atomic Energy Agency (IAEA) and has been president of Australasian College of Physical Scientists and Engineers in Medicine, 2009 to 10. He has organized two major conferences, EPSM 2000 in Newcastle and the 17th International Conference on Use of Computer in Radiation Therapy, ICCR, in Melbourne, May 2013. He has been chair of the Awards and Honors Committee of International Organization of Medical Physics, IOMP, and served for 6 years as Chief Examiner for International Medical Physics Certification Board. In 2014, Tomas was awarded an Order of Australia Medal, OAM, for his services to medicine, research, and education. So I'm sharing the screen. I'm giving it to Professor Kron.
Thank you so much, Arun, and good morning, good afternoon, and good evening, wherever you are. Thank you so much for sharing your time with me, and a topic which is not frequently discussed in medical physics. I'm just sharing my screen, and you should now be able to see a screen which is in normal mode, saying medical physics workforce development. And I'm now moving to the full screen. So I hope you can still see me, and you can see the slides. I would also like to encourage you to interrupt me really at any time. This is a topic which is not sort of a classical topic about medical physics, dosimetry with ionization chambers. It is about medical physics and it is about emerging technologies, but it will not cover any of the emerging technologies in great detail, nor will it make a lot of comments about medical physics, which is really a wonderful profession. It will mostly really look at development of workforce, or basically education of medical physicists, and how can we prepare medical physicists for what is ahead. So it is very much a presentation about professionalism, about profession, and about education overall. So I hope it actually fits quite well in this series of webinars, and you may find some of these things interesting. It also lends itself then to questions and answers. And I can't pretend that I'm an expert on education, but I will obviously try to answer all questions as they arise throughout the lecture. We don't have a final slide to get to, so please interrupt me, please engage with the topic, which I think is very rewarding, maybe not quite as rewarding as ion chamber measurements, but it certainly is something which is of great value for our profession. Before I get started, I would like to introduce you to the radiotherapy clinic I'm coming from. I'm from Peter MacCallum Cancer Center, and we are fortunate to be a rather large radiotherapy center with a lot of emerging technology. Now I have installed our first dual energy CT scanner in radiotherapy, have access to PET CT and MR. We are also a big group because we are including both imaging physicists and engineers in one group, which is physical sciences, the group I have the privilege to chair. That means we have sort of an opportunity of performing education between different groups, and sort of trying to be interdisciplinary in some respects. That has resulted in us having 2 postdocs, a couple of PhD students, and 7 medical physics trainees. The US would call these residents. We call them registrars, and they are basically with us for 3 years undergoing clinical training. And this clinical training is clearly one of these underlying things which underpins this preparation of the workforce for emerging technology. And as I mentioned before, that struggles both radiation therapy and imaging. Talking about my institution also reminds me to give you a background of my conflicts of interest, or the potential conflicts of interest. And I think it is, in particular in an educational lecture, quite important to be cognizant of the conflicts of interest, because whatever equipment we have, whatever people I work with, will influence what I'm going to share with you. And in this case, we are working with varying medical systems, with Vision RT and Reflection, which is a PET linear accelerator manufacturer. I should also just mention in passing that I have always had an interest in education, and I have actually done some formal education myself. And I think that also is reflected in some of the things I'm going to share with you, and is also giving sort of a bit of a nudge to encourage people here to think about maybe learning something about education overall. Back to the title, back to the main story as such. What this actually means, medical physics workforce, is about humans, about staff. It is not really about the equipment as such, and the focus of this lecture will be really about education training and a bit about certification. If I now look at this from a human perspective, and looking at the human engagement, there are sort of 2 different ways how one can see the development of a workforce happening. One is on the left, where the workforce just organically moves along and fills all the open spaces, all the needs are addressed just in an organic way, like the development of a plant. That is not necessarily the approach which is typically taken, which is more like the picture on the right, where the development involves human engagement both in a sort of play form, where people explore things, where people experiment around, and people work and perform manual tasks. The scaffold here, which is sort of these bits here, which keep up the building and also allow us to extend is a very useful metaphor for education. It basically means we can build on some of the things which we have already learned and build on that. At the same time, try to put new things, new bars in the context of other things. It's a bit like Lego building as well. And it is really this type of education which I would like to share with you. So the assumption is that the workforce development is an active process with human intervention and human actors who actively pursue this and not just passively follow the sunlight to some direction. I should also give you a warning. This lecture is as much about education as it is about physics. So it does bring in some new jargon, some things which we typically don't talk about all that much. We do mock treatments with mock interviews. Simulated workplaces. What the heck are these things? Work-based learning is obviously something which is important as such. And people in education, they often sort of work with these sort of organic trees, which sort of illustrate concepts, how they are linked and how they are building up to then careers and the ability of physicists in this context to deal with complex technology. It's always good to start off with some definitions. Workforce is the medical physicists, and emerging technologies are all sorts of things where I sort of would say they are novel, but likely to be used clinically or just about to be used clinically. They're not necessarily widely available. There are all sorts of issues that they are not part of the standard education. So our registrars and residents, they do not necessarily learn about all the emerging education parts. They're not necessarily part of the syllabus of the IAA, which guides us through training and education programs. And there are not necessarily safety standards established. Examples would be motion adaptive therapy, theranostics, online adaptive radiotherapy, intraoperative RT, and cardiac SBRT. So a whole variety of things which are sort of just emerging. I should point out, though, that emerging is context dependent. So a center, and you may come from a center where 3D CRT, conformal radiotherapy, is the standard of care. In that case, IMRT is emerging because in your environment, safety guidelines are not necessarily established. The documentation is not clear. Patient selection, all these things are not clear. So emerging is something I'm using sort of very broadly to describe everything, which is a bit challenging, is new, and does require some additional information, some additional skills and competencies to become part of the profession. So what I'd like to do in the next 40 minutes or so is really discuss overlap of professional activities, just sort of have a look how our field has evolved, then briefly introduce educational theories, consider the need for lifelong learning and CPD, and explore then the role of mentorship, which isn't in this forum such a big surprise that mentorship should play part of this education for emerging technologies. I will introduce a bit of jargon on the way, and I do need to make the disclaimer that I'm not an expert in education, but we all are often called upon to be educators. And what I'm trying to argue for is that education is a real science and is something we do need to engage with and need to appreciate in all its variety of different shapes, forms, and methods. So if I look at the traditional workflow of radiotherapy, then we have the patient coming, having a diagnosis, there's a prescription, there's planning, there's quality assurance, treatment, and follow-up. And you can see that there are different professions associated against these that might change in different jurisdictions ever so slightly, but broadly it is like that, and the physicist is very much linked to this part here, maybe setting up the planning system, maybe doing the treatment, maybe setting up treatment machines, and in some circumstances also doing treatment planning. But it is all really very compartmentalized. And that is really how our education works. Our syllabus, and if you look at the IAA syllabus, it is compartmentalized in treatment planning, external beam radiotherapy, brachytherapy, and it is really just physics. It's the physics role, it's what we do in terms of physics. Now, an advanced workflow, for example, though, in adaptive radiotherapy, as an example, looks a lot more complicated. And that means that we now have additional active actors there, like radiologists, maybe a radiobiologist. If you do a PET-guided adaptive radiotherapy treatment, there are also additional tasks which appear there. And there is overlap between the actions of the different people. So more professions, more complex tasks, need for automation to make things and feedback loops fast overall. And there's this overlap of tasks. It's clearly non-linear workflows. And you can ask yourself now, is the traditional education, which educates physicists for 3 years and educates radiation oncologists for 5 years and educates RTs for 2 years, and then brings them all together in the clinic, is that really the best model of equipping our future workforce for the tasks at hand? So I'm basically proposing that when we talk about workforce, we can't really restrict ourselves to medical physicists. We do need to look at all the other parts of the workforce as well, and look at how do we interact with them, how do we teach each other, how do we grow as a multidisciplinary team. And that is something which in our institution, for example, is enshrined in what we call tumor streams, where work is guided through different tumor streams. So we have a head and neck tumor stream, we have a neuro-oncology tumor stream, we have a lung tumor stream, and all these professions, they are working together in these streams on one common problem. And that is probably something I see in modern technology becoming a really, really important guiding principle for what happens overall. And that leads to different workforce development approaches, where team teaching, which is basically meaning that teachers with different expertise teach the same group of professionals. So we have radiation oncologists teaching physicists. We have RTs teaching physicists. We have nurses teaching physicists, for example, about pacemakers. And that leads to a different type of professionalists. And we have group teaching, where teaching of a group of different professions, of a group of professionals is done at the same time. I had the privilege of being teaching in a course for groups of radiation oncology professionals in treatment planning. And we basically gathered one radiation oncologist, one physicist, one RTT from the same institution, people who should be working together. We gathered them together and then sat in front of the treatment planning system with the whole team and discussed what should be done in particular tasks. And everyone from the different professions brought different ideas to it, to the process. And I do think that we see probably a lot more of this group teaching there, because it is actually a very efficient way of getting new technology into the clinic. We did that, for example, when we installed a gamma knife, and we sent a whole group of people to training, RTs, physicists, and ROs. And they came as a team, and they were educated as a team. Just checking. Yep. Then we also have different ways of these workforce development approaches, different dimensions, as I would call it, where teaching can be done teacher-centric, learner-centric, or content-centric, personalization versus equality of access, and basically saying, can we personalized training and say this is potentially a future leader, while these people are potentially better group team players, or should we make sure that everyone is treated in exactly the same way and has exactly the same opportunities? There are practical approaches, there's reflective approaches, and there's theory as such. So overall, it becomes a rather complicated an environment for teaching as such. When we talk about different professions, I should briefly sort of mention also the role of manufacturers, and in particular in countries where new equipment is really driving a lot of the development of technology. Manufacturers become really important. They have the task of enabled safe operation. They do provide essential documentation, offer essential training, and provide application support. So manufacturers play an important role in this preparation of the workforce overall. But I would like to caution you a bit. The manufacturer or the sales part of the manufacturer is really sort of shown here, and they are really very happy to demonstrate to you all the wonderful feature, all the good things. They probably don't tell you all that much about what can go wrong or what happens if you have one car from one manufacturer and a road from another manufacturer, and so on. While the physicists really are much more interested in what goes wrong as such. And manufacturers, in fairness, often are really handicapped by trade secrets and potential conflicts of interest. So I think it is important that as a medical physics profession or as a radiation oncology people, that we are trying to become as independent as we can possibly be from manufacturers and really establish our own way of thinking and establish our own competence. If one looks at this picture again, then we do need to recognize also that in order to develop our workforce, we first must understand what the medical physics role is in this treatment scheme. And I'm purposely sort of put the physicists really at all sorts of different bits into that treatment scheme, linking the physicists more to really the patient journey rather than to individual bits and pieces in there. And that's really where a term that is widely used, scope of practice, becomes important and potentially problematic from my perspective as such. Scope of practice describes the activities and duties that healthcare professionals are permitted to undertake. Now let's let that sink in for a moment, and then obviously you're coming to think licensing, thinking of guidelines which say this is what the physicist does, but not this. And there are, in virtually all professional organizations, have some sort of key capabilities and enabling components for scope of practice. I'm always trying to sort of not warn people about the scope of practice, but to be cautious about scope of practice, which is obviously a common term in medicine, because it says the radiation oncologist must do the prescription, for example, even if the surgeon does the brachytherapy implant. The radiologist must order the X-ray, even if the surgeon in the operating theater actually puts the foot down. There are these scopes of practice which clearly make sense, and there are boundaries of activities which are often linked to licensing and some sort of formal recognition, some exams, some payment of fees, and often also insurances as such. However, medical physics is particularly tricky in this context, because if you look at the job description of most professionals, there are typically about 5 different tasks in there. If you look at a radiographer, then what are the tasks of a radiographer? And then you look at a medical physicist, and we went through this when we had a external review of our practice. Then in our medical physics practice, I had at least 20, 30 different tasks, from radiation safety to security, to development, to dosimetry, to commissioning, huge number of different tasks. And that makes it typically quite difficult for medical physicists to define our scope of practice, in particular, to define it in a way that it becomes exclusive. So as a medical physicist, and I think we are also, on the other hand, very well prepared for this development of a future workforce where these boundaries are a bit more fluent. Scope of practice can vary in different jurisdictions, and it is always a danger for us that if different professions share the same scope of practice, there's an incentive for the employer to say, well, we just get that one who can do that cheapest. And, well, I hope it's typically not the medical physicist who is the cheapest, because that means our salaries are not high enough. But I think the physicists can hopefully always demonstrate that they add value beyond being the cheapest. And that is done in many professional organizations increasingly through sort of advanced practice and advanced practitioners as such. Our college sort of looks at a number of advanced practitioner practice things. And I think that that's a very useful way of saying these are the sort of minimum tasks a medical physicist can need to have. And then on top of that, we build sort of additional programs which may or may not have certifications attached to them. That takes me now back to the education of the workforce. But before I go on, I just wanted to quickly see if there are any burning questions. If not, we come to the juicy part. Education of the workforce. And here I would like to just get across to you that education is not something which we can just do because we know something very well, medical physics. It does not necessarily mean that we are also good educators. And education really has elements of psychology, anthropology, pedagogy, philosophy, medicine, didactics, a whole variety of things, and obviously also physics, I would hope. So let me share with you a couple of theories, learning theories, and that's just a typical selection. There are many, many, many more of them, and there are different flavors. I just find these 5 quite useful to look at. Behaviorism is something where learning is basically attributed to doing the same thing over and over again and getting rewarded if you do it right. So in this case, we assume the learner is a blank slate. The teacher does something, the learner repeats it. If they do it right, they get rewarded. Repeat it again, do it right, rewarded, and so on. And obviously in this context, Pavlov and his famous dog, Skinner, Watson, American psychologists really come to mind and are linked to that thing. Each of these theories of learning is typically also associated with some famous names of famous people. Some of them you may have heard of, like Piaget or Vygotsky. I'm not saying you need to read any of these, but it's sort of, and I'm not saying that you need to decide on any of that. All I'm trying to say is there are theories, and these theories can be useful to identify particular approaches to teaching. And we've looked at behaviorism already. Let's have a quick look at cognitivism, which is a very common thing in our field. And it basically is looking at the way that humans engage in what they are learning. And I think that's sort of the most common way how we teach physics. We plan something, then someone is observing it, think about it, analyzing it, what have we done, potentially write down, journal it, what we actually have done, reflect on why was that good, why was it significant, and so on. And many of our journal articles are also really structured in this cognitivism way. Basically, different cognitive processes that contribute to the learning are attention, memory, thinking, problem solving, creativity. And these are all things we all are familiar with. This is something which is typically characterizing our medical physics training. It also is part of my presentation because this slide where I gave you the objectives, basically planning the lecture and giving you an opportunity to sort of prepare for what I'm going to cover, is very much informed by cognitivism. So if I'm an educator looking at a cognitivist approach, well, I obviously would show you an objectives slide at the start. Connectivism is something more modern that has only really sort of came up in the last 10, 20 years as such. And connectivism is something where the philosophy of teaching, the theory is that it's not really the contents, but it's the connection between different things, which really constructs the meaning, constructs the knowledge as such. Diversity is good, but as long as things can be looked at together, that's obviously something in a computer age really very, very common. You think often, well, you don't need to have any facts. The facts are in your mobile phone. They are in Google. All you need to be able is to take the facts which you need and connect them to your problem. It's the connection between the facts which are readily available in the computer world and the problem, which is really the important thing modern people need to think about. This is something which is clearly an evolving and a popular way of thinking about it. It maybe from my perspective, not the only thing. It certainly has some ideas of truth, and it has some interesting connotations and implications. It also obviously would say that learning may reside in non-human appliances. So, well, artificial intelligence, we are training a computer. It also perceives connections between fields, ideas as a core skill, and it is really the problem to be connected to the answers, which you can come then from wherever. But it also means that the currency, the up-to-dateness of knowledge becomes really, really important and probably also quite easy to achieve because in a computerized world, everything is really up to date. Doesn't answer really the question as to how you decide if what the contents is that really appropriate as such. The last two, constructivism is sort of something built on previous knowledge, where you basically have someone active participating in building something, an edifice of knowledge. So as long as you know your algebra, then you can get your statistics, then you get your clinical trials, you get your clinical evidence, and you're sort of building one thing after the on top of the other, building sort of a scaffold to build yourself on. And then the last, humanism, is a learner-centered approach, where basically the idea is that the humans left to their own devices, will just pick up the right thing. They do need to be given responsibility, and then they will grow into that overall. It's a very individualized way of looking at development. That was really sort of all I wanted to say about the theories, and I don't want you to take these theories home as such, but I want to just alert you to the fact, that there are lots of thinking behind the way education is going about, and how we can take our workforce and develop it further as such. And there are a variety of different ways how this can be thought about. And I'm not saying one or the other is better. I probably would just say not one is right. One really has to sort of pick probably a number of different approaches to different problems, to different learners, to different teacher styles. I just want to now spend another 10 minutes or so looking at a couple of other considerations for education and staff development in practice, starting with the environment and then looking at the size of the workforce in the end. Let's look at the environment. And the environment for what we intend to do is obviously the workplace. There are a couple of things which are really good being in a workplace because it's clearly relevant. Whatever the workplace shows is relevant for the education of people, can improve performance, so managers like it, changes with the workplace, so up-to-dateness is really something which is built in. Documentation is easy and required. And there are clearly supervisors around with the right skills, basically supervisors there. And there are good models. But it's not all good to have the workplace as their learning environment, because if someone is formally learning, they are not productive. And as such, this may not be valued by the employer as highly as it should. There is focus on assessment rather than contents because the employer wants you to get across the line as such. Lots of distractions. We know that if you want to do a self-learning module somewhere and you are at your clinical workplace, there's really not much time to actually do something. And well, there's not necessarily teaching experience there. And that is really a really true issue. There are only very few natural teachers, and teaching is something which can be learned. See one, do one, teach the rest is not necessarily a good recipe as such, and training does exist. Awareness is probably already a really good starting point, and that's sort of what I'm trying to do here in this lecture. Learning in the workplace, there are lots of theories around it. Can happen at different levels as such, or different phases, as this it is called here, which is often sort of linked to also different levels of competencies. It requires engagement, but can be easily integrated and it is clearly part of a healthy continuing professional development mix. And as such is really lifelong, because emerging technology, what is emerging today, is not emerging anymore tomorrow, but something else is emerging. And then the day after tomorrow, something else is again emerging. So emerging in itself just inherently includes that idea of CPD. There are lots of guidelines about CPD, and depending on what type of certification you have undergone, recertification, relicensing, and so on, will require some way of certifying that. This is from a book by the IAEA, Possible Systems of Categories for CPD, and they include professional activity, and that is probably a really important thing. As long as that's documented and sort of reflectively thought about in a cognitive fashion, then this would constitute CPD. So CPD is sort of part of our task. It addresses our task of skilling the workforce for emerging technologies. Quick example, in our group, in our team, we have a number of different meetings there throughout the week, including one CPD meeting for all staff, where staff can participate in a CPD activity. We have special training sessions, but also a special session for supervisors, where we try to discuss the problems the supervisors have with their trainings. We've sort of moved through all this already and are now quickly looking at the use of technology, which is obviously something which enables us here to meet together. Where would we have been able to have these sort of webinars and these sort of discussions before 10 years ago? Very, very difficult. So technology has enabled us to do a lot of different ways of thinking, approaching teaching. And obviously teaching, if I'm teaching in a classroom and I have a whiteboard, my teaching style is quite different to the teaching style in a webinar as such. I'm not saying that I'm doing a good job. That's up to you to decide, but it is different, and it needs to take into consideration the technology available, the environment available. The ease of access to data and information is something we have already talked about. The reliability of data and information is something different, potentially. Artificial intelligence is obviously really an absolutely fantastic tool. I'm not a great programmer, but I can ask ChatGPT to actually write a script for me, and that is pretty amazing, isn't it? Does that mean that we are de-skilling people, that they can't do certain things anymore? Maybe not. These discussions are still really ongoing, and obviously technology poses a tremendous challenge for assessment, because cheating is something which is standard practice, and unless you have an oral exam where you directly talk to someone, there are so many ways that an essay can be written in a different environment, that it is quite challenging to think. Also, is an essay still something which is an appropriate assessment for people? So that clearly leads us straight into a number of ethical issues, but they are not just related to technology. Ethics goes throughout education like a golden ribbon overall, starting with access, and that's probably already the most important thing. Do people actually have access to education? Does everyone here have access to more than webinars? Do you have access to manufacturer training courses? All these sort of things are really an ethical issue. The reliability of information is something which is more increasingly difficult to actually look at. The question is education something which should be driven from within, or is that something we should force upon people? Difficult. Equality, transparency, resource requirements, and assessments we have already talked about. Lots of pitfalls, and I don't want to go through any of this in great detail. Happy to discuss some of the issues, but I just want to make sure that when we talk about upskilling of workforce, that we keep some of these ethical issues in mind. When we talk about physics, we probably also have to acknowledge that we are actually the high stakes. Not all professions are necessarily of the same high stake, but physicists who are sort of guardians of safety you really want to make sure that you have a good physicist if you're having radiotherapy treatment. So the stakes are high, both for the people who don't know who the physicists are, society, but sort of have an inkling that, yeah, when there's radiation, we may really need to do something about it. These society needs to be reassured. There needs to be some QA of the education. Has it worked? Just because someone was 5 years at university, does that mean they are now qualified and good? Uh, does a particular course in general work just because it's in Harvard? Or does it work for an individual? So assessment certification is really important. And that's sort of a typical drawing diagram, which sort of shows how that works, where society really is interested in these high stakes. Society wants to have good medical physicists, even if they don't know it. They don't know what medical physicists do, but they clearly know that they want safe radiotherapy and high quality imaging, and as such. So society says, I want high quality images. Then it's their peers, colleagues, who actually develop the assessment criteria and procedures, and hopefully also the training and development of their workforce as such, which then leads, if one looks at whole workforces or workplaces, to accreditation, or individuals to credentialing and certification. In Australia, this is sort of basically the pathway of medical physicists, which follows these IAA documents as such. But if one looks at this, this is also a really sort of a stressful process. It's a formal process. It focuses on competence and skills. It's very regulated, and your supervisor needs to know exactly what they do. There's really not much time as well. There's time pressure as well. And it needs to have sort of independent oversight. So this leads me to the last part of my lecture, to ask, should we really just think in this sort of linear fashion to a certification process and then doing scope of practice of the physicist, or is there potentially a bit more to all that? After all, we spent 40 years of our life in a career, and we probably want to have a bit of fun and contribute to more than just good dosimetry as such. This is where I think a mentor can enrich the workforce development. A bit of history. Mentor is a term from the Greek mythology. It's a person in the Odyssey, where Ulysses sort of travels around 10 years after the fall of Troy, and his son is at home waiting for dad, and the teaching is actually done by a goddess who comes in the form of mentor and sort of and helps the young fellow. Many interpretations of mentorship exist, and typically they would involve someone from outside the direct workplace. So it's not a particularly good idea if your supervisor, who signs off your timesheet and makes sure that you get paid, that's not a good mentor. The person who actually requires you to do a particular job, not a good mentor. Typically, the mentor would be someone who is more experienced and is able to provide, hopefully, support beyond the technical issues, potentially give sort of career advice, sort of looks at things outside ethics, maybe, and so on. A nice example I'm involved with as well is the ICRP, the International Commission on Radiological Protection. They have created a mentorship program where task groups have mentees who then support the task group. So can also say it's a bit of exploitation happening here, but it sort of works both ways. The mentees do some tasks, literature search or so for the task group, but at the same time learn about processes and contents of the ICRP, and it's certainly something which I would hope is good for the career. an organization I'm involved with as well, Medical Physics for World Benefits, has done a survey of mentoring, of virtual mentoring, which just has been published in the Journal of Medical Physics. And I thought I'd just leave you with a couple of thoughts from that paper. It's open access. Jake van Dyke, who many of you probably know, is one of the first authors, and Robert Girai is the senior author. Robert Girai, who also has really given lectures here, I think, in this forum as such. And the idea was really to ask medical physicists all over the world, what is it about mentoring you would think is important? What is it about mentoring that you think is helpful for your career? And there were 396 respondents. It's pretty good. So it's a reasonable sample. And these are all the sort of size, the people, where the people actually replied from as such. What do physicists expect from mentorship? Well, responses related to the mentoring process. How often should mentees meet? Once a week, at different frequencies. And you can sort of see the majority sort of think about monthly is not a bad way of doing things. Is a formal agreement required? Well, not necessarily, but some people think it is important because it sort of lays out exactly what this relationship is. How long should meetings be? You can see the results here yourself. And I'm not saying there's anything right or wrong there. It just sort of is helpful for us as mentors to get sort of a feel for how things are. And I encourage you to actually download that paper, Journal for Medical Physics, and you can just Google virtual mentoring and download it. Have a look. How does that fit with your expectations of mentoring if you are in a mentorship arrangement? And then the question was there: what is important for mentoring overall? Improving patient and staff safety was very important. It was probably the most important thing, and solving clinical physics problems. So interesting and really sort of positive to see. Improving industrial and commercial interactions was really much less high on the agenda of most people. If one looks at the barriers and limitations there, this is grouped in low and middle income countries and high income countries. And you can see right from the very start, there are differences in terms of what people expect or see as the main barriers. And I think these things are really, really important for us in terms of education overall, not just mentorship, because that helps us overall as a community to understand what are the things which drive education, drive people to upskill to emerging technology. And that takes me to the sort of concluding remarks, which often really end up being dollars. Who is paying for all this? And there is quite an interesting discussion about do employers pay for continuing education or for upskilling, or do learners pay for that? Or should the government pay, because the government in the end is really the society which defines the attributes and has the most final benefit of this exercise. We also need to be cognizant the more expensive education and upskilling gets, the more peaked the situation becomes. And typically people would argue that the higher the qualification of individuals is, the less of them we actually need in the end. Is that true? Difficult to say. Is that economic reality? Probably yes. So the tasks for future workforce is education getting us any closer to the emerging technology? These are the sort of tasks which I see informing us as a profession, engaging with modern technology and emerging technologies. Safety and quality, obviously, yes. There monitoring efforts and developing procedures. Monitoring efforts in this case is actually seeing what we are doing. Is that actually making a difference? Then managing projects and risks, TG 100 comes to mind, FMEA. Monitoring performance, making sense of data, obviously AI. Looking beyond physics, we already sort of mentioned ethics a bit, but immunotherapy, theranostics are not necessarily directly physics driven, but have other important pieces of knowledge that will inform how our emerging technology is best used. Horizon scanning clearly is there, and managing people as well. So what education do we need? What education do we need to do? We need to learn with and from each other. I think education is really something which brings people together from different diverse workforce as such. We do need to learn better how to manage projects and risks, make sense of data, use automation for the benefits of our patients, link efforts to clinical outcomes. Again, 3 times I'm sort of looking at actually verifying that what we do is not just we do it because we do it because we do it because the guidelines say it, we do it, but it actually does make a difference. And then probably the take-home message I find most relevant is that it also leads to some enjoyment of what we are doing, and that comes easiest if it actually makes a difference. So thank you very much, and I'll leave you with the words of a very famous education analyst, John Dewey, who basically said the goal of education is to enable individuals to continue their education. So thanks very much. Happy to answer questions.
Thank you so much, sir. We have one question. Is there any certification exam for medical physicist professional in Australia where Indian medical physicists can participate? And examination is online or offline?
I think the only thing which is currently really open are webinars, and our college ACPSEM does webinars. There are also universities who run open lectures as such, but there is nothing which is freely available and structured in a way that can take you from A to B, even if you don't want to take the exam. So nothing straightforward. The best tools and things I'm aware of would be on the AAPM, the American Association of Physicists in Medicine webpage, educational resources there. They are clearly very, very useful.
Thank you, sir. One more question is there. We aim to establish a residency program in Iran. However, due to the challenge of unpaid position for residents, we plan to implement it as 1-year program. What is your suggestion regarding this approach?
You have to start somewhere. I was actually at an IAEA course for establishing a clinical training program in Hanoi earlier in the year. And we had people from a variety of different socioeconomic and environments. I think the main message is that the training programs which are recommended by IOMP, by IAEA, by AAPM, ACPSEM, they are all ideal. But it is, rather than just looking at the ideal, it's much more important to get started. So I think making practical use of what is available, and being able to establish a one-year program would be a fantastic achievement from my perspective. Two things are probably important in that context. One needs to be still ambitious in terms of the outcomes. This cannot be sort of seen, oh, this is just second best. No, that's not necessarily the case. It would, for example, be useful to look at the BABA course in Mumbai from the Indian Radiation Safety Group, to have a one-year program which is really, really high level as such. It's not medical physics, not clinical medical physics, but sort of illustrates that a lot can be achieved in 1 year. And I would also suggest that you have at the end some sort of exam or test, not necessarily for the individuals going through the course, but also to see, does the course or does the training do what is supposed to do. And if you have, let's say, 10 institutions doing this, you can then sort of learn from each other and say, well, this institution, everyone passes everything all the time. They're brilliant. So what are they doing right? And then others can learn from that. So I think it will be important to include an examination process. The IAEA is starting to develop some resources for that. And I think I can probably get you in touch with someone there if you send me an email.
So one question, like, how do you see the role of artificial intelligence impacting the future of medical physicists?
I don't know. I think if you look at hospitals, then the medical physicists are probably the first, or some of the first, to work with artificial intelligence. We have at least some of the training which is required as such. Typically, we will be the ones who will be called upon when it goes about auto contouring, which is sort of typically the first step. It's typically physics conferences like the ICCR conference where artificial intelligence is discussed. I think it will obviously be very, very important. We need to make sure that this becomes part of our scope of practice, if, for want of a better word. So administrators, hospital CEOs need to, when they read AI in our hospital, they need to think, I should ask the medical physicist. I can't tell you how it will pan out. Personally, I would caution at least people like myself not to lose skills. I think we need to make sure that artificial intelligence is supporting what we do, not doing what we do. We still need to be able to do things. And an interesting example, for example, is treatment planning. Many of us have done treatment planning in a 3D conformal world. So you get sort of a feel how to place radiation beams. With VMAT or arc therapy, many people don't learn that anymore. I still think this is probably a useful skill which underpins at least my approach in terms of how do I look at a plan if I see that a lot of the monitor units are delivered from directions which I would typically have thought to place a beam. And that's sort of a good thing, and allows us to do a quality assurance check of things. And I think we need to be really mindful that the same is there for AI. I think very high. I think explainability of AI is important. I think we will see a lot more probabilistic approaches where the AI not just tells you 42 is the number, but AI tells you 42 plus minus 1.3 is the number.
Yes.
And then I think we are starting to have a tool which is more calibrated to our needs. But that's just my personal musing. I think others are much cleverer and know much more about AI than I do.
Thank you, sir. So it looks like we have this much on the questions. So we'd like to thank you for your valuable time. And I want to thank Professor Kwan, Professor Eba, and all the people who have attended this webinar. And thank you so much for giving your time, sir, for this presentation.
It has been a pleasure. Thank you for staying with me. Thanks for that journey.
Thank you.
Bye. Have a good day. Bye.
Bye. See you soon.
Have we stopped recording?
Thank you, sir, for your guidance.
We have stopped recording?
No, sir.